1 in 8 women in her lifetime will be diagnosed with breast cancer. Baptist Medical Group has dedicated surgeons who see patients and understand the importance of the surgeon's role in recovery and treatment. Joining us now is Dr. Alyssa Throckmorton, a breast surgeon with Baptist Medical Group. Thank you for being here today.
Sure, thanks for having me.
Tell me exactly what encompasses your practice. What do you do?
Sure. So at Memphis Breast Care, our practice has 2 and kind of half of a physician and then also a full-time nurse practitioner. And what we do there is evaluate women for a spectrum of breast diseases and complaints, anywhere from breast pain to I've got a new lump to I've already had a biopsy and I've got a breast cancer and what do I do next? And so we handle all of those different types of questions every day.
What are some of the newer treatment methods and procedures that are done now with women that are diagnosed with breast cancer?
One of the things that's newer that both Dr. Vanderwald and I did training in as part of our breast fellowship, which we use for appropriate candidates, is the nipple-sparing mastectomy. We're not actually saving any of the nipple tissue per se, but we're just saving the skin of the nipple, which provides a very nice reconstructed result and sometimes can also trim down the amount of procedures that a woman has to have in order to have a fully reconstructed breast after a mastectomy. We also place, one of the newer types of radiation is a short-term 5-day radiation treatment called accelerated partial breast. We don't do the treatment in our office, however we do place the devices that the radiation doctor can use, and we do those under ultrasound guidance. In terms of medical treatments, similar, not things that we do, but things that we do spend a fair amount of time talking to women about at the beginning of their breast cancer journey, are things like using chemotherapy before surgery to shrink tumors. We talk a lot about endocrine therapy or different types of medication that are prescribed for women for estrogen positive cancers. And then also we talk to a number of women about ways to reduce the risk of breast cancer when they're found to be high risk, either from a family standpoint, family history standpoint, or previous biopsies that they've had.
Walk us through a little bit this journey that ladies have with breast cancer. They see their doctor or they find a lump themselves, they get a mammogram, it's suspicious, needle biopsy is done, they have cancer. Then what? What's the next step?
Sure. Most of the, so everybody's journey is going to be a little bit different, and and that journey may be different either because of the type of breast cancer that a woman has or some of her other health concerns that may affect the types of treatments that we offer, or even some just personal preferences even, are some things that can change what one woman has as opposed to what her sister had or her next door neighbor or a friend from church. Most women start with a surgeon. The majority of breast cancer treatment planning starts usually with a surgeon because most women at some point during their treatment plan will have surgery. And so we kind of are usually the initial kind of gatekeepers or whatever you want to say and start that discussion. Sometimes the next move is women go to surgery and have whatever they're going to have done. Sometimes, depending on what kind of tumor they have, we may send them to see other specialists before we make a final treatment plan. And we're trying to do more and more of that in terms of making a combined plan or a joint plan with other important providers. We've already talked about plastic surgeons, but radiation physicians, medical oncologists, sometimes even genetic counselors are part of that treatment planning process, because we do sometimes see women where the family history is such that we say, you know, this is somebody where maybe we need to look for one of these breast cancer genes before we finalize her treatment plan.
So you're the captain of the ship, sort of, to begin with.
I think most
women
feel that way.
There. The next question I want to ask you is something I'm asked every day in the primary care clinic, because there's always controversy on television and radio about mammography.
Sure.
Tell me what the proper guidelines are for mammography.
The U.S. Preventive Task Force said let's start at 50. And that's because we see fewer women under the age of 50 diagnosed, and in that group you have more false positives. But I would say what most of the major medical societies, including the American College of Surgeons, American Cancer Society, the American College of Obstetrics and Gynecology, those groups all still recommend starting screening at the age of 40 for average risk women. There's one of the other questions sometimes we get is, well, when do you stop? And a lot of the studies looking at mammography enrolled patients, for example, under the age of 70 or 75. And so the question is, should we just stop at 70 for most women? And I think that question has more to do with a lot of the woman's other health, and as her primary care doctor, you're probably the best person to advise her on that. If you've got somebody at 70 or 75 who has a lot of other comorbidities and you expect that in the next 5 years her heart disease is what may kill her, then screening may not be of benefit. If we find a little small cancer that we can cure, that may not effectively lengthen her life. However, today I saw a very sweet lady over the age of 80 who, takes one blood pressure pill, one cholesterol pill, and some vitamins, and that's about it, and lives by herself.
Need to aggressively take care of them just as well.
Right, and so, my expectation based on some of the insurance actuarial tables is that her life expectancy isn't 5 years. Hers may already be 10 because she's made it to her age without another significant event.
Well, thank you so much for being here today. This is Dr. Throckmorton, and we really do appreciate her being here today. This is Dr. Mark Castelaw with Health Matters.